Hi, my name's Marie and I'm going to be your nurse today. Is it okay if I do a head to toe assessment on you?
That's fine.
Yes. Okay, let me just wash my hands. We'll clean my hands really quick. And use some hand sanitizer. I'm gonna close the door for privacy. Can I see your wristband really quick? And can I have your first and last name?
Paula Castañeda,
And your date of birth?
42601.
Awesome. Okay, I'm just gonna do a little inspection. So here I just see that she's dressed appropriately for the weather. It's hot outside, so she's wearing shorts and a short sleeve. She's well groomed. There's no strange odors. Her skin looks good just from afar. Okay, we're gonna get started. I'm gonna take your vitals, okay? So we're gonna get started with pulse. We'll start with pulse. Alrighty, if I could just have your hand. And I'll be checking the radial pulse. Alrighty, so that was 40 in 30 seconds. You multiply times 2, so it's 80 in a minute, which is within normal range. Now we're gonna check, let's check that pulse again just to confirm it. And then this time I'm just gonna pull your hair back here. If I could just see that again. Alrighty. Alright, in there I was actually checking her respirations. I didn't tell her so she wouldn't alter her breathing. And now it's 9 in 30 seconds, so that'll be 18 in 2 minutes, which is within normal range again. And then I am going to change her pulse oximetry. So if I could just have this finger right here, and then she doesn't have nail polish. I'm just going to stick it here, just relax it. And we'll let that do the reading. And that was at 97%, which is within normal range again. Alrighty. Now I'm going to take your blood pressure. And then let me just clean my stethoscope really quick. back and relax for me. Put your arm right here. And just relax it as well. Okay, sit this way. Awesome. And then beforehand, we did check that it was the correct cup size for her. And it's not too tight. Okay, and that was 121 over 79, which is within normal range again. Let me take this off. Thank you so much. All right, and now I'm just gonna ask, are you in any pain at the moment?
No.
Nope. Okay, sounds good. Okay, so we're gonna continue with the head and face inspection. So first I'm just gonna look at her head, and it looks normal cephalic, so it's normal shape. I'm gonna look at her ears. I don't see any abnormalities on that one. This one looks good as well, and I'm gonna look at her eyes. You could just close them and open them. Okay, and then I'm gonna look at her nose. There's no bumps, there's no cuts, there's no crusting, no dryness. And I'm gonna palpate her scalp. And again, there's no flakiness. I don't feel any cuts, any bumps. Okay, so now I'm gonna palpate her sinuses. And here we're just using direct percussion. You don't feel any tenderness?
No.
No uncomfortable?
No.
Okay. All right, and I don't feel any tenderness there. So now we're gonna check for sharp and dull. And this is going to be cranial nerve number 5. So this is what soft feels like. This is what sharp feels like. You're gonna close your eyes and tell me what you feel. Ready? Sharp. Soft. Sharp. Soft. Sharp. Sharp. Soft. Okay, so our cranial nerve number 5 seems intact. Now we're gonna check cranial nerve number 7. So you could just smile for me. If you could frown. If you could wrinkle your forehead. If you could puff your cheeks. Awesome, so that seems intact as well. All right, now I'm gonna palpate her temporomandibular joint. You're just gonna open and close your mouth. Go ahead. Open. Open. Okay, and there's no cracking, there's no abnormal movements, so that's good. Okay, and now we're gonna check her eye structures. So first I'm gonna palpate the lacrimal glands. Okay. And now I'm gonna check the corneal light reflex. So I'm gonna point the light in the middle of her nose and check for strabismus. So you could just look straight ahead. And and the light reflects equally on both pupils, so that would be negative for strabismus. Okay, now we're going to do the 6 cardinal fields of gaze. So you're going to follow my finger. And please don't move your head. Okay, now we're going to check the pupillary light response. So I'm going to point this at her pupils and they should constrict. You can just look ahead. All right, that was good. Okay, now we're going to check her visual fields. So you're going to look straight ahead. You're going to cover one eye. And you're going to tell me when you see my fingers wiggling in, okay? Let's do that one first.
They're coming in. Coming in as well.
Let's do the other one.
They're coming in. And they're coming in.
Okay, so that was great. It was pretty much equal on both eyes. Now we're going to do one more test. You're going to look at my finger, and then you're going to look at the wall. Then look at my finger, and then look at the wall. Ready? Look at my finger, look at the wall. My finger, the wall. My finger, my finger. All right. Okay, so we're going to go ahead and check her hearing. We're going to inspect her mouth, and we're going to inspect her nose as well. Okay, so you're going to cover that ear first. I'm going to whisper 3 words, and you're going to tell me what I whispered, okay? Just look straight ahead.
Red, blue, sunflower.
Awesome. You can just cover your other ear.
Cat, dog, hamburger.
Okay, and that was good as well. You can just look up a little bit. I'm going to check your nose. Okay, and there's no deviated septum there. Now I'm going to check inside your mouth. Just look at your teeth, your gums, your tongue, just your oral mucosa. You could open your mouth for me. Check out your tongue. Lift it up. Move it side to side. And open your mouth wider. Okay. Now I'm going to check cranial nerve number 10. So I'm going to have you say ah as you stick out your tongue, and I'm going to make sure your uvula rises. Stick out your tongue, and say ah, ah. Okay, and that was great. So now we're going to check cranial nerve number 12. You're going to say light, tight, dynamite. Go ahead.
Light, tight, dynamite.
Okay, so that cranial nerve is intact. As we're going to continue on to the neck. So first, I'm just going to palpate the carotid, the thyroid gland, and the trachea. I'm just going to move your hair really quick. Okay, and for carotid, make sure you only do one at a time. Alright, and I don't feel any abnormalities there, so I'm going to palpate your trachea. You can just swallow for me. And as far as the thyroid gland, I don't see a goiter there. Now we're going to check your range of motion. So you could just move your head from side to side. Okay, you could just move ear to shoulder. Okay, you could just move your head down and up. Now we're going to do the same things, but I'm going to apply resistance with my hand, okay? So I'm going to place it here. You want to push this way. Okay, same thing this side. Okay, and now I'm going to check the strength. So you're going to want to push your shoulders up as I try to push them down. And push up. Okay, and that's intact as well. So now I'm going to auscultate her carotids to check for bruits as well as her thyroid. Okay. You could just relax for me. You could hold your breath. And breathe. Hold your breath. And breathe. Okay. So I didn't hear any fluids there, so that's good. And now we're going to continue assessing the upper extremities, but before I do that, I do want to palpate her lymph nodes. So there's quite a few right here, like the preauricular, postauricular, there's tonsillar, submaxillary and submandibular. And then supraclavicular. And I don't feel any enlarged lymph nodes there. Now we're gonna move on to her arms. So I'm gonna check for color, for temperature. So I'm gonna make sure she doesn't have any cuts, bruises. Okay. Let me check your temperature. And I'm gonna check the capillary refill. Just gonna press on your nails, you just relax. Let me check this one. And that's under 3 seconds, so her capillary refill is good. And now we're gonna check range of motion. So I'm gonna give you my hands, and you're gonna try to squeeze them. Squeeze my hands. Okay, so the strength is there. Now, you're gonna move your hand against resistance, okay? So stretch out your hand. You're gonna push it down as I push it up. Push it down. Okay, another one. Try it again. Okay. Now you're gonna push it up as I push it down. Awesome. And this one. Okay. Now we're gonna do it to the side. And it will be the same concept. So push down and push up. Okay. Push down and push up. Awesome. Okay. And then I'm gonna check your pulses. So I checked the radial pulse earlier, so I'm just going to check the ulnar, just make sure that it's not irregular, and the brachial as well. I'll do it on this side. Okay, so the radial, I did it earlier, but I'll do it again. And that's normal. Let me check your ulnar. This one's more diminished. It's a little bit hard to find, but it's there. And the brachial. And that one's regular as well. Okay, so I'm gonna continue on to the assessment of her back and her lungs. So I'm gonna start with her back. First, I'm gonna just check the skin, see what it looks like, see if there's any abnormalities. Okay. And while I'm here, I'm gonna check for CBA tenderness. And I'm gonna do this through indirect percussion. Okay. So tell me if it hurts. Did that hurt? No. Did that hurt? No. Okay. I'm gonna keep checking your spine, so you could just stand up for me and stand over here. You're gonna face that way. You're gonna bend forward, try to touch your toes, and I'm just gonna check your spine. And you just stay like that. Okay, and you're good to sit down. And there I didn't see any scoliosis, I didn't see any abnormal curvature of her spine. Now we're gonna move on to the lungs. What I'm gonna do first is I'm gonna check for tactile firmitis. So I'm gonna put my hands on your chest and on your back, and you're gonna say 99, 99, 99, okay? I'm just gonna feel those vibrations. You can just keep saying the number 99. And let me start with the front. Move your hair out of the way. And go ahead.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay. And then if you could just switch over to that hip, so I could do it on your back. And you could just see the 99 a little bit slower for me. Thank you. And I'll tell you when to start. Go ahead.
99, 99, 99, 99, 99, 99, 99, 99.
Okay. And what I'm going to do now is I'm going to do indirect percussion just to check for that resonance in her lungs. And you could just relax for now. I'm just going to be tapping around back here. And the way I'm doing it, I'm just putting my hand down and tapping on my finger. Just go through the bottom, it's a little bit easier. Okay, and if you could just turn it. Okay, so we're gonna continue that indirect percussion just to check for that resonance. Now, if you could turn back that way for me, just move your legs over. Now I'm going to check for that lung expansion. So what I'm going to do is I'm going to put my fingers here as she takes a deep breath in and out. And I'm going to see how my fingers separate. And they should separate equally. So when I tell you, just breathe in and out. But I will let you know. It's going to be deep breath in. Go ahead. And out. And in. And out. Awesome. Okay, so my fingers did separate at the same time, the same distance. So now I'm just gonna auscultate her breath sounds. And then as far as me seeing her respirations, she doesn't seem like she's struggling. I don't notice any shortness of breath. I don't notice any apnea where she stops breathing. She's not wheezing. I don't hear any abnormal breath sounds. So now I'm just gonna auscultate. So the way I'm gonna do this, every time I place the stethoscope in a new spot, you're gonna breathe in and out, and touch in and out, and touch in and out, okay? Is that okay?
Yes, that's fine.
Okay, I'll tell you when to start. And start. And now you could just turn back around. I'm going to do the same thing in the front. It'll be the same process. Go ahead. Thank you. And there I don't hear any abnormal breath sounds as well. Okay, now we're gonna continue on to the assessment of the chest. So first I'm gonna inspect, see if I see any abnormalities there. Sometimes you can see like the palpations. So we're gonna just look first. Just gonna look through here. So now I'm gonna percuss. I'm gonna palpate and I'm gonna percuss at the same time. Okay. Okay. So you're just checking for that resonance. And now I'm gonna auscultate. So I'm gonna listen to your heart sounds. And I'm gonna go under your shirt, okay? Let's see which angle would be easier. I'm gonna have you sit on that side, please. Thank you. Just so it's easier for me to move my stethoscope around. And I'm gonna go under your shirt, okay? Okay, so here you do it. Check the apical, the pulmonary, the herbs, the tricuspid, and the mitral. And that mitral one is a little bit hard to find on the female, but I can hear the S1, the S2. I don't hear any murmurs. I don't hear any extra heart sounds. No S3, no S4. The rhythm seems normal. It's not irregular. And we're done inspecting your chest. Okay, so we're going to continue on to the abdominal assessment. And here you just want to make sure you auscultate before you percuss or you palpate so you don't cause any sounds that were not there before. But first, I'm going to inspect. I'm going to lift up your shirt, okay? And I don't see any abnormal colors, any lumps, any masses, any cuts, any bruises. So everything looks good there. So now I'm just going to auscultate for those bowel sounds. Alright, and those sounds are present in all four quadrants. They're not hypo or hyperactive. They're normal. Now I'm just gonna percuss and then I'm gonna palpate. now I'm going to palpate. I'm going to start with light palpation and then I'm going to go more deep. And you tell me if it hurts, okay? So I can stop. Okay, so we're gonna finish off with the lower extremities. First, I'm just gonna inspect them. I'm just gonna look at your legs, look at your feet. Okay, I'm gonna check for edema. Okay, and I don't see any edema there, so I'm going to check the temperature. You could just move your arms to the side. Thank you. Okay, so the temperature is the same throughout the whole leg. Now I'm going to check the pulses. Okay, and the pulses are present and regular. So what we're going to do now is check your range of motion. So if you could just lift up your leg and put it down again. And down. And the other one. And you could just move your feet down. And up. And down. And up. Okay. You want to just lay down for me, please? We're going to keep checking the range of motion. You could bring your knee to your chest. And stretch out. And the same thing. And stretch out. You could just move your feet inwards and outwards. Okay, you could just turn back around. Then we're going to check the same thing, but now I'm going to apply resistance, okay? So you're going to want to move your leg up as I try to push it down. Go ahead. Okay. And then let's do this one. Okay. And we're good. Okay, so we're going to finish off the assessment with a neurological assessment. So first I'm going to check for light touch. You're going to close your eyes. I'm going to touch your face and tell me when I'm touching your face, okay? You tell me when I'm touching it. Just close your eyes.
Okay. Are you touching it? There too. There. 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 There.
Okay, awesome. So what we're going to do now is we're going to check for stereognosis. So I'm going to put an item on your hand. Your eyes are going to be closed and you're going to tell me what you're holding.
Okay.
Close your eyes. Let me just get this. You can feel for it. Just don't open your eyes. I'm telling you what you're touching.
A key.
Awesome. Can you just give it to me? Thank you. Okay, now we're going to check graphesthesia. So I'm going to draw something on your hand while your eyes are closed and you tell me what it is. And I'm going to be writing a number, okay? So you could just give me your palm. I'm going to use this to write it. Close your eyes. I'll tell you when to tell me, okay? What number was that?
8.
I'm going to try it one more time, okay? Awesome. So those were 8 and 3. So you can open your eyes now. What we're gonna do is the finger to nose test. So first let's practice. I'm gonna have my finger here. You with one finger touch your nose, touch my finger. You try that? Nose, finger. Try it again. Nose, finger. So you're gonna keep doing that while I move my finger around, okay? It's gonna be nose, finger, nose, finger. And we'll start off with nose. So ready? Nose. Keep going. Awesome. So that's good. Now we're going to check rapid movements. So you're going to put your hands on your lap. You're going to flip them as fast as you can, okay?
Okay.
Are you ready?
Yes.
Go ahead. Okay, we can stop now. So that was coordinated. She could move both hands at the same time. So now we're going to test your walking. Okay, you could stand up for me, please. First, we're going to do the wrong bird test. So you're going to stand with feet together, hands by your side. You're going to close your eyes, and I'm going to check if you wobble, okay?
Okay.
Close your eyes. Okay, awesome. You can open your eyes now. Now we're going to do the tandem walking. So you're going to walk one foot in front of the other. And you could just start off on that side, on that end. You're going to walk this way, all the way to where I am. One in front of the other. Go ahead.
Whoa.
Okay, that's good. You lost your balance a little bit, but that's okay. So you want to just sit back down for me. Okay. And then lastly, I'm just gonna ask you to walk normally. I'm just gonna see how your body moves with it. So you could just stand up on that side again. And then just walk towards me just normal. And walk away. Awesome, thank you. You can sit down now. Okay, and that's the end of our head to toe assessment. Thank you so much for helping me out today.
Thank you.